Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the Trubal Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
So Statistics Canada is showing that there's definitely racial inequalities when it comes to Black adults and higher risks of mortality as a result of lack of preventative measures that are taken for Black people. Take a look.
We're seeing here racial inequalities that play out literally in death, because we're talking here about mortality. This is about people dying from these conditions.
A report released by Statistics Canada highlights how Black adults face an increased risk of death from certain diseases compared with their white counterparts. The report's author says the findings can help inform better healthcare decisions. For Black men, the relative risk of dying increased by nearly 140% for those living with HIV/AIDS, 42% in pancreatic cancer patients, and nearly 20% for those with prostate cancer. For Black women, the relative risk of dying increased by 500% for HIV/AIDS patients, 98% in mouth cancer patients, 56% for those with stomach cancer.
Some of these conditions, so things like HIV, diabetes, cardiovascular outcomes, are conditions that are either preventable or they can have very good outcomes if they're caught early. So what this means is that there's a miss, right? There's a miss when it comes to prevention and a miss when it comes to screening.
Kind of strategy that mobilizes the investment, it mobilizes the research, and then mobilizes the focused interventions that are necessary to address these issues over the long term.
We want to be able to see this as a first step that we describe, we find out, and now we have to figure out why and then address and eliminate these disparities.
So as you can see, the numbers are quite staggering for the amount of illnesses that Black adults are known to have a higher risk of dying from. And that's all due to lack of testing. And so as they said in the report, is the white people get all of those tests, but when Black people go for testing, these things are not done. When I go for my annual physical, I ask for more testing because they'll do the standard CBC, which is the complete blood count, and then they'll do x-rays and ultrasounds and stuff, but it's based on me saying, I would like this tested. Can I please get this tested? So for Black people in the Black community, it's very important that you take charge of your health and make sure that you're educated about what tests that you are, entitled to. Otherwise, when it comes to us, it's not going to get done. Even when you get your blood work done, the testing that they pull or the resources that they use or what they draw from is based on a 25 or 35-year-old adult white male or female. When it comes to Black people's blood work, they do an equation. So they'll say, this is based on a 25-year-old white male or white female. So what you have to do is take these numbers and do this equation, and then you'll know what the numbers are for a Black person. They don't have this information in Canada due to lack of race-based data. So as a result of that, everything is measured based on a white person. And that is also the case when it comes to preventative testing. And so it's very important for us to take charge and say, I want to get this test. I heard that I can get this test at age 40. For example, there's a test that exists where you can find out if you are predisposed for diabetes, for example, and it's a foot test. And it's supposed to be done at the age of 40, but they won't do it on us. They don't. And so we have to make sure that we're well aware of everything because the testing is there. We don't have the added stress of having to pay for them because the Canadian health system, the Canadian medical system it's covered because based on our taxes. So it's not necessarily free, although that's what they like to say, is that free healthcare. It's not. It's coming out of our taxes. However, we have the luxury of going in and getting all these tests done and not having, being hit with a massive insurance bill. So we need to take advantage of that and get the testing done. They will not do it for us. We have to take charge. The call to action now is, as this sister said, is to look at it and find out why. Why is there a racial inequality when it comes to Black people? Why are we not afforded the same amount of rights and testing? Why is there systemic anti-Black racism in the health system in Canada? That we need to understand, and we need that to be fixed so that our health matters too. Our Black lives matter in Canada. So if there's something going on with you health-wise and you go to your doctor and it's dismissed, or it doesn't seem as though you're getting the help or the testing that you think you're entitled to, go to another one. Be persistent about your health and don't accept no for an answer. And don't accept just the basic testing. Take charge of your health, take charge of your body, and then also do your best to live a healthy lifestyle so that you don't have to be in front of a doctor to get this kind of testing other than the standard annual physical. Shame on you, Canada. Do better. Let me know what you all think about this. Don't forget to like, subscribe, and share this content. Also download the African Diaspora News app. You can grab it at the Google or Apple store or head over to africandiasporanews.org and grab it there. You'll have access to content you won't see here or anywhere else. Exclusive, wonderful content. So download that app. Also subscribe to my YouTube channel, EA Public Relations. Until next time, please be safe, everyone.